Hello and welcome into another episode of Ask the Experts. Our expert today, Dr. James Sturm, we thank you for being with us. He, of course, is the man behind Find a Better You Med Spa in O'Fallon, Missouri. We appreciate your time. How are you?
Well, and thanks for having me.
Absolutely. Let's start by just learning a little bit more about who you are. Who is Dr. James Sturm?
Well, I'm a board-certified aesthetics physician. I believe in minimally non-invasive techniques, giving patients, clients the greatest results with least amount of risk and downtime.
It is an ever-changing industry. What was it about this industry that initially caught your attention?
Well, I love the artistic side of it. It's a bit of sculpting. Undergraduate, I had degrees in chemistry, general science, but also in art. So I like the artistic expression of it.
And that really is an important part to all of this because every canvas, if you will, is different. Every patient is looking for something different as well. And you really are an artist in how you go about giving these people what they're looking for. And it takes a great amount of practice to get to that point. And you've gotten to that point.
Yes.
All right. So let's dig into what we look at as a patient comes in. We already talked about how everybody may be looking for something different. When someone comes in for that initial consultation, what is it you and your team are trying to help that person figure out?
We meet with the client and they give us a wish list, what they would like different about themselves, what they would like to improve upon. Often we have them bring old photos. A lot of clients would like to look like they did 20 years ago. And so as a reference point, but we also ask them to make a wish list and place it into a level of priority.
Okay. Fat reduction is one of those things that you guys offer, and it can often be one of the more popular things that people are looking for when they come to your practice. Let's talk a little bit about deciding what's right for each client.
Well, we do a full consultation, including medical history. Ideal candidates for fat reduction would be somebody close to 30% of their ideal body weight. Often with their wishes in the initial consultation, I get an idea as to what's appropriate, what can be offered, what's feasible, and set realistic expectations.
And I imagine that's a bit of the challenge for both yourself as the doctor here and for patients, is finding that balance between what someone may want and what is capable of happening, and you strive to meet in the middle to find something that is suitable and reasonable for both parties.
Correct. And what's appropriate for our clinic. There are some that need more aggressive, invasive techniques, and we would refer them on to plastic surgeons.
One element that goes into all of this is a lesson on the different types of fat and the body makeup of a patient as it relates to those different types of fat may make or break what you are able to do for them. Let's just crash course here on the different types of fat.
Well, so there's essential fat, subcutaneous fat, visceral fat, and some will describe it as white, brown, and beige types of fat. It's important. Fat destruction techniques, fat sculpting techniques, it's not a substitute for weight loss. Individuals with a large amount of visceral fat, the visceral fat can often cause diabetes, high blood pressure, elevation of cholesterol, elevation of triglycerides. So that's part of the overall initial consultation to see where somebody's at. Now, if someone's motivated and they've been losing and proper diet, they're the ideal candidates.
If you are just joining us, we are chatting with Dr. James Sturm from Find a Better You Med Spa in O'Fallon, Missouri. It's a difficult industry in that it is very personal. The choice to have these type of procedures, people come to this decision a lot of different ways. We've talked about the different types of fat that are out there. We've talked about some of the different procedures. You mentioned invasive. Describe how a more invasive procedure is different than some of the others.
If somebody has an extreme amount of laxity, they may be, examples are if somebody has flappy upper arms, also known as bat wing deformities, or somebody has a overhanging abdomen, a pendulous abdomen, then they might need a tummy tuck, or otherwise known as an abdominoplasty, and the arms are known as brachioplasties. Concerns about those procedures is they're more costly, longer recovery, and they do carry a higher surgical risk.
There are some things that your practice offers that aid a bit in particularly the anesthesiology aspect of this and the post-treatment as well. Walk me through what some of those things are.
Right. Well, I've got several board certifications. My primary board certification was anesthesia. We also have a pain practice on the other side of the same space, which has been subdivided. The anesthesia portion allows me to do cases in my office. The safest way of doing liposuction is using tumescent liposuction, which can be done fully awake. We are prepared and set up to do sedations in the office for those individuals that need that. It adds to the risk a little bit, but for some individuals to get the optimal result, anxiety can play a role.
And make no bones about it, these can be painful procedures. And I think that is something that people are made well aware of and probably have some idea of, but in the consultation aspect of things, they are really kind of told and instructed, and it's talked about.
Yes. So once we have a plan, we go through the pre-procedure preparation, actual procedure, and then the recovery, and have a discussion as to what to expect.
Once the actual procedure day gets there, walk us through what someone can expect.
Well, it all varies. I'm trying to offer for the office to give individuals, we offer laser hair removal. I have certified technicians trained and certified by the company who makes our Candela Gentle Max Pro laser. And so those medical assistants perform that. I'm always on site, so that's markedly different than having a liposuction in the office. I've had the laser hair removal performed by my staff on myself, so I can tell you exactly what it feels like. It's not that bad. Definitely something that can be done at lunchtime. We have other techniques in the office for individuals with a lot of with mild to moderate degree of urinary incontinence. We have a CO2 laser for vaginal rejuvenation, vaginal tightening. So that can help, and that's another office-based lunchtime type procedure. Most of our clients are women, and laser hair removal can be done anywhere in the entire body, with exception inside the nose and inside the ear. In more intimate areas, they prefer to have the female technicians present in the room, but I'm always on site if need be. So the same is true for the vaginal rejuvenation. So that's markedly different. That they can come in, be in and out within 30 minutes, depending on how much is being done. For liposuction, the advantage we have in the office is the procedures are done in my office. I am not under pressure to move along and speed things up. I can take my time. I don't have a near arthroscopy, waiting for the same operating room and someone tapping their foot trying to tell me to get it done. So I really enjoy the sculpting of the liposuction. For a liposuction, a client would come in, we place an IV in everybody. If they wish to have sedation, we do monitor vital signs. There's the preparation, actual procedure. There's the fitting of the garments afterwards. That often takes hours.
Cost is something that is obviously top of mind for anyone who is interested in learning more about one of these procedures. And one thing that I found really interesting in just researching for this interview is you're very upfront about costs and additional costs that come along with this, because I think, correct me if I'm wrong, as far as transparency is concerned, I imagine it's much easier to just have those discussions up front with people than on the back end.
It is, so that these are procedures often not covered, most of the time not covered by insurance. And we, in the office, because I have control of the office, I don't have, there's not a surgical suite for a hospital or for a surgery center. The garments, I often, most of the time, combine radiofrequency skin tightening techniques, and those are combined, and those costs are all up front with the procedure. Average cost for a liposuction, not including an operating room anesthesia cost, nationwide is about $6,200. Our liposuctions are about $5,000. Because I have the procedure room in the office, there's not the cost, the added fees of a surgical suite in a hospital or a surgery center, which are often the same cost as the surgical fee, if not more. So we have a cohesive staff, well-trained staff, so patients feel comfortable in our setting.
If there were any misconception about this industry that you'd like to clear up, just to give people who may be considering one of these procedures more peace of mind or that extra boost to learn more, what would it be?
The training, there's a lot of variability out there as to how a practitioner approaches. Some more aggressive tend to reach for the tummy tucks and the brachioplasties. I use minimally invasive techniques. Our incisions are 2 millimeters. The ports that we use often hide our ports within the belly button, and they heal up within days, and it's very difficult to even for me to find the sites. That's not true with all the ports, but the majority of them are heal quite nicely. There's a lot of variability on the client that someone's treating. I have seen recommendations for tummy tucks, and knowing well that would be an 8-inch incision compared to a 2 millimeter incision.
Wow.
So,
before we leave, where can people find out more about your practice?
We have a website. It's Find a Better You. It's stllipo.com. We're in O'Fallon, Missouri, just north of Progress West Hospital.
If I've learned anything, it's that this is a practice that has a wide range of products available to customers. It is a technical industry, but what I've learned just in our meeting here today is that you're willing to sit down with your staff and let people know everything ahead of time so that they can have their questions answered. I appreciate your time. Dr. James Sturm, Find a Better You Med Spa. Great to meet you.
Thanks for having me.
All right. And that does it for this episode of Ask the Experts. We look forward to being with you again next time.